My name's Chad Kessler, and I'm an emergency medicine doc, and I serve as the executive director for emergency care for VA. So that's 150 plus hospitals. We see about 2.5 million visits every year, huge number, largest integrated emergency department and healthcare system in America. In the thick of things, people were just flooding in, and people didn't know what to do. They were worried, they had no idea what's COVID, I don't know what's going on. New York, New Orleans were getting slammed. So COVID in 20, or C20, is a little show. It's half podcast, vidcast, it's half TV show. It's getting information out to the field from the field.
Happy July 4th weekend. Thursday late afternoon on the East Coast and back down through Central to the West Coast. We're so excited to have you with us this Thursday afternoon and this long holiday weekend.
We could have given them a PowerPoint. Could have sent a Word document out about how to intubate patients with COVID, same information, but we thought no one's gonna care. People are gonna dump that. They're not even time to check their email now. They're working 16 hours a day, 4 days a week, 5 days a week. And so what we did was we brought on guests, thankfully and graciously at the end of their long shift, and said, hey, what do you do when you have 8 patients in the waiting room and they're all COVID? How do you separate them out? Where's the cold and the hot zones? People had no idea. And so this was an opportunity to share information, but at the same time, people were worn out already working these crazy hours. So we added some humanity. Come for the information, stay for the music. So we had my buddy who's a Marine, who's executive officer for emergency medicine, Josh Geiger, work with me. And he sings and he plays guitar. So he would come on and lead in the intro with some guitar.
Josh is a Marine, once a Marine, always a Marine. Tell us a little bit, Josh, about why join the Marines?
That answer is so simple. Everybody knows the Marines are the best, and I just wanted to see if I could do it.
Love it.
And it grew and grew, and then we'd have people sending in pictures, so we'd show a picture. Or we'd make a video of a patient, veteran, getting discharged from the hospital, and all of New York was cheering, and they were playing Here Comes the Sun. And we just did it. It wasn't great. It was a grassroots. We'll put on the camera. I'm gonna put on the video. It probably sounded like crap. My daughter put a picture in the back of C20. I had her draw a little crown, and we went. It was really modeled after the Some Good News. That's what I saw. I was so inspired. I was like, I wanna do Some Good News. It added some humanity. It was a time for people to take 20 minutes, take your 20, that's what we said, to come on and just, debrief.
I just want to share my motivator right here. One of our nursing assistants in the New York Emergency Department who lost his life to COVID. The take-home message for this would be, we have a mission, that these brave people who are out there on the front line, and some of whom have given their life so that others may live, is compelling.
I love chai. So I always had this cup of chai, and then I was like, we have an iCare award: integrity, commitment, advocacy, respect, excellence. And I was like, we should make it a Chai Care Award. So we made the Chai Care Award, a little mug, cool logo. If you win this Chai Care Award, we give you a gift certificate to go to your local canteen, VX, and get a cup of coffee or a chai. And I had so many people write me in, hey, did you know that in Hebrew, or if you're Jewish, chai is chai, spelled the same way, which is life, and that's what we're celebrating. We're celebrating life.
Cheers and chai. Have a great day.